We've been talking a lot about people in Black and brown communities having particular concerns about the COVID vaccine's safety and effectiveness. Although Black, Hispanic, Native American, and other people of color are overrepresented when it comes to severe cases of the coronavirus, vaccine hesitancy among these groups and others can complicate the decision about whether they want to be vaccinated. So here to speak about that is Dr. Kevin Stevens. Thank you so much for joining us this morning.
Good morning. How are you this morning?
I'm doing lovely. How are you?
I'm fine. Thanks for asking.
Good. And I'm glad we're having this conversation. It's one of the ones we've heard a lot about when we talk about the coronavirus vaccine, hesitancy from Black and brown communities. And to be fair, we should also say some new studies have shown that it's actually white Republicans who are the most hesitant about the vaccine. It's important to talk about with Black and brown communities, though, because we're seeing more severe cases of coronavirus in those communities.
Yeah, that's correct. I mean, if you look at the data, what you'll see is that the death rates, the hospitalization rates are about 2 to 3 times greater in the brown and the Black community. So with the death rates and so forth, we have a bigger problem that we need to address for sure.
Sure. And what are you hearing? Let's take a chance to talk about some of these myths that we're hearing around the coronavirus vaccine. Why are you hearing some people say, I just don't want to take it or I don't trust it?
But, you know, I think part of this is just some people saying it's too fast, that this just happened like overnight. But if you look at the data, what you will see is that this vaccine has been developed. The mechanism was developed over 10 years, and we were just waiting. And finally, we have the opportunity to use this new technology, particularly the messenger RNA technology. That's something that's fairly new in terms of how we use our vaccines. So that's one problem that people have. And of course, there is a general, sometimes a distrust for health professionals because of the health disparities and all the things that we have known in the past from the Tuskegee experiment and those kind of things. So there is a little bit of that. And then, of course, it's somewhat, I guess some people are just hesitant because of just vaccines in general. I mean, if you look at the flu virus, we still don't have, perhaps 50% of people get the vaccination for the flu, which is still very low. And so all of this kind of contributes to this resistance, I think.
Sure, and you are right. There's a lot of people who don't believe in getting the flu vaccine. I've heard many times in my life people say the flu vaccine gives you the flu.
Yeah, well, so that's an interesting thing because the flu vaccine particularly is what we call attenuated, a crippled vaccine of a virus. And so that's something different than what we have now with the messenger RNA, particularly Pfizer and the Moderna. It's not even a flu virus, a flu particle. A viral particle, it's actually a messenger RNA. It's a whole nother different technology. And so you don't get the virus for sure when you get Moderna and the Pfizer vaccine. That's a totally different mechanism.
Yeah, what should also comfort people a bit is now we've seen so many people get the vaccine and we're not seeing tons of cases of serious side effects, if any.
And that's the good news. That's the good news that when you look at the adverse reaction profile, what you see at most of the time people have like a little soreness in the arm. Sometimes they can have a little fever or something, but it's very transient. Usually it's about 1 day. And very rarely do you have a severe reaction. But what you see now is, I think what we're seeing over the country is that the rate of deaths, the rate of hospitalization, all of that is falling down. And when we get enough people, we can get, I don't like the word herd immunity, but we can get people immune, then we can reduce the mutants and the variations that are coming out, which are really problematic, the UK, the Brazilian, the South African. I think the quicker we get this thing under control, the better it is for everyone.
Sure, and this vaccine puts us on the right track. So Dr. Kevin Stevens, thank you so much for joining us for that conversation.
Thank you very much.